Welcome to Medicine and Healthcare Around the World, the podcast where we connect with passionate people from all over the world that are making an impact within the field of medicine and health. So, if you're tuning in to listen to one of our many great stories from wherever you are and wherever you're headed, please be welcome, friend, as we're about to get on with today's episode.
Health is a complete state of well-being, physical, mental, communal. It's not merely the absence of disease. So we come at it with that approach of holistic health. Isn't just absence of disease.
Katie Baric is the co-founder and executive director of Hands On Peru, a global health NGO dedicated to providing holistic health to vulnerable communities in Peru. Katie and her team built Peru's first Center for Public Health, CESAPU, where they empower their communities through prevention, education, and by creating economic stability through their social brand Chimuk, which generates a dignified income for over 20 artisan women through their beautiful hand-knitted work. Now let's get into the episode. All right, Katie, thank you so much for attending this podcast. I have to say that you American organizations, in comparison to us Europeans, are killing it out there, I'd say, in Latin America. So I've done an interview with Jeff Mapp for the Extra Mile Pediatrics in Guatemala and El Salvador, with Dr. Wetzel and Milagros Coronado for the Global Health Initiative Peru that they have with Wabash College. And, here's another one, the Hands On Peru. And I'm really starting to find out about this amazing global health initiative, and it's really motivating me in my medical career, So thank you so much for taking the time to attending this podcast. We have a few things to discuss, but could we start, if you don't mind, with your story and how it relates to the creation of Hands On Peru?
Yeah, hi. It's an honor to be here. Good morning. Greetings from Huanchaco, Peru. I'm along the northern coast, and I arrived here for the first time in 2013, but my journey with global health started in 2006. So when I was at the time 12 years old. I went to Honduras for the first time with my dad and the church, the Catholic Church. They have a sister parish mission, and so we would go down. Essentially, Pope John Paul II tells rich churches to help poor churches and to create channels of resources. So I started going down to Honduras. I went as a girl, and I went back throughout my adolescence and my college career. And I got to learn Spanish, learn what it was like to live, even though it was short term, in Honduras, understanding the poverty, essentially, and getting to know people. And from a young age, I realized that what I wanted to do with my life was work in global poverty. And so I went to Uganda in my senior year of high school. I came to Peru in my senior year of college thinking, oh, okay, I'm going to, I want to be a physical therapist, and I want to travel the world and do like global work and help communities living in poverty. So by the time I came to Peru, I knew that my life was going in a direction of doing mission-based work in community development. And so I came to Peru. I spent 5 weeks here, and the coordinator of the program at the time, Her name was Rosa. She said to me at the very end of the program, she said, Katie, I love what I do, but I don't like who I do it with. I want to start a new nonprofit. I want to start a new program. I need a business partner from the States to bring me volunteers and resources. And I see you're passionate about this. Do you want to be my business partner? At the time, I was 21 years old, heading into my last year at NC State. And I thought about my life. I thought about what I wanted out of it, and I saw it as a cool opportunity. So I said yes. And together we created Hands On Peru. And then I decided no to the physical therapy, and I went and got my master's of public health. I studied in the behavioral community health sciences department with a certificate in global health from the University of Pittsburgh. And I loved it. The courses were like women's empowerment, environmental health, like community health. And I'm like, wow, this is awesome. This is everything I want to learn. So after I studied my master's of public health, I Hands on Peru at that time had 3 years, and we had over 100 volunteers. And I came down to Peru to see Rosa, and she was living here full time, and I was living in the States full time. And we said, all right, this is like do or die. We either need to leave the organization or grow the organization. And we decided to grow it. We decided to build our own center. It made sense at the time. We just need to build our own center. We'll do all of our activities there. We'll bring all of our volunteers there. We'll like make sure it's like one project, because we would go here, we would go there. It was more pop-up campaigns we would support, but it wasn't like, a very sustainable program. And so we decided to build our own center, and I went back to the States, fundraised $50,000, and by December of 2016, we had our own public health center. And that's where their story really starts. So that's how I got here. And yeah, it's been a wild ride.
Yeah, sounds like it, and wow, what an amazing journey from the travels through Latin America, the master's degree in, if I'm not mistaken, did you say public health?
Public health,
If
yeah.
I'm not mistaken, public health, and uh, and I imagine the center is now. Forgive me for my pronunciation, but is it? I heard it when I watched the videos on the website. CESAPU.
CESAPU,
Am I pronouncing
Centro de Salud Pública.
CESAPU? Centro de Salud Pública, like the Center of Public Health
Mhm.
in Spanish. And so, but before we delve into the specifics of this, of the organization and CESAPO specifically, because I have some things that I really want to cover in the terms of the services you provide, but you said there was a do or die at one point before you expanded the organization. What were the issues, if you don't mind me asking, at that point? You had a volunteer program, it sounded like, but something was, am I understanding it right? Something wasn't really.
Well, it was growing. It was growing beyond our capacity, and we were putting volunteers, part of our volunteer program, and it's still like this, was putting volunteers in rotations in local hospitals. So they would go into hospitals and health centers and essentially shadow other doctors or help with triage. And it became so many volunteers that we were struggling to find, because not only does the place accept them, but it has to be a doctor who says, yes, I want to take them. So it was like this struggle. It was like, and then campaigns, where are we going to do? It was just all out. It felt like a lot of work going out, asking other people for favors. And it was like, we don't want to do this anymore. It's easy to do when you have 3, 6, 10 volunteers, but when you have a group of 18, you have to look for a lot more. So it became this sort of, we're spreading out too much, and we wanted to kind of bring it back in. And if we wanted to keep growing and keep having volunteers, it was like, how are we going to best funnel them and best use them for like one project? And for me at the time, it was like career time. I graduated with my master's. I'm not going back for a doctorate. I was done with school. I was like, get me in the community, get me in the real life. And so it was either, okay, I can sit here and stay in Peru and you know, keep using, because we did have a lot of energy. We worked with a lot of clinics. We worked with a lot of doctors, a lot of people. It was a lot of good energy. Um, and it felt kind of a waste to release it. because I either way I wanted to live and work in South America and in community health. So I was like, I can either create my own project or I can leave this, go back to the States, say, hey, World Health Organization or CDC, put me in Latin America as your community organizer, you know? So I was like, I can either do it myself or I can go back to the States and have someone else send me. And doing it myself just seemed like the most logical step
Yeah,
forward.
yeah.
It made every step of the way made sense. It was a very almost easy path forward. Every path forward made sense. So people say, "Oh, that must have been really hard," but at the end of the day, it was honestly kind of the easiest thing I've ever done because every everything just made sense.
Well, how so, if you don't mind me asking, that it was the easiest thing that you ever
It
done?
just like I said, it was like there's already all this. Why would I leave all this for something that doesn't exist? And nobody ever told me no. Nobody
No.
in no moment ever said, "You can't do that. You can't build a clinic." Never. So when I said, "I'm gonna build a clinic," everyone was like, "That's a great idea." Oh, okay. And so, I was just surrounded by people telling me that it was a good idea. And
Mm,
so mentally, I didn't have to overcome any mental, should I do this? What should I do? Because I feel like that's where a lot of people get stuck. What should I do? How should I go forward? For me, it was very clear. It was like, oh, okay, yeah, let's build a clinic. We're okay, boom. So mentally, it was the easiest thing I've done. It was just an easy
right.
decision, perhaps.
I imagine. And was it, so we talked about that you traveled to Peru earlier before
Mhm.
you started, was it 2013, if I'm not mistaken, the initial organization before CESAPU was built. But did you have already a kind of networking of people because of those travels that you did to Peru? Like people that you know, and so maybe that could have facilitated the whole process?
Yeah, of course. Mhm.
Right.
And I
Okay.
didn't wanna leave that
Well,
network because for me, it was career, you know? I needed to start dedicating myself. So I didn't wanna leave that network and that energy that we had created.
mm, yeah.
Yep.
And so before we delve into the CESAPU and the organization, was there a specific reason, because you traveled to other parts of Latin America from what you've told me so far, was there a specific reason for Peru specifically? Just
No, no specific.
just feeling.
Just a feeling. I love Latin America, and, I remember when I was a tiny little girl, something about Peru stayed in my mind. I don't know what it was. Some seed was planted about Peru, so when I had the opportunity, it was like, "Oh, let's go to Peru," and maybe I just had this deep knowing, but I still question, like, why Peru? And the answer gets revealed little by little as to why I'm
Right.
here. But I Peru is an amazing country. There's like the evidence of the first civilizations to exist on Earth here. There were civilizations from the time of ancient Mesopotamia. So I think, something about this place pulled me in.
If not the people, I imagine, the Peruvian people I've met, who've only been a few, but we have a few communities, especially in Sweden, of Peruvian people, and they're really warm, friendly, and it's good people, at least those that I've met, and it's good, good place to start, I imagine, a global health initiative. And so we have the creation of the Centro de Salud Pública, the CESAPU. Or sorry, did I pronounce that wrong again?
No,
CESAPU,
CESAPU.
right?
Or
CESAPU,
however
CESAPU,
you want.
CESAPU. And I'm just gonna thank you for that. I'm just gonna mention a few things. It's a health clinic, and again, sorry for butchering this in Spanish, but could it be pronounced in Trujillo,
Trujillo.
Trujillo,
Hmm.
Trujillo, Trujillo? And you have primary care. I'm just going to go through a few things here, but you have the primary care, disease screening, ultrasound screening, nutrition consultation, physical therapy, eye exam, dental care, and you have a whole kind of community-based program that Chimuku, maybe we can get into that a little bit later, the kind of alpaca, what do you call it? The alpaca
Knitting hats.
uh, Yeah, hats, clothes, wear attire that you produce too, which is amazing. But as you, can we talk a little bit about the services you provide? You know, I just mentioned them a little bit superficially, but how did you decide for this when you set out the patient clinic, the CESAPU?
It decided for itself.
Oh,
So the clinic started in 2016, December of 2016, so essentially January of 2017. And, it went, and then the pandemic hit, and then we closed, and then we reopened in halfway through 2021. So the clinic is almost 10 years old, and it has had a variety of faces. So the way it is now, the services that we provide now started in basically in 2022, because we've had so many years of learning experience of what people needed, what people were asking for, um, and things like that. So the clinic started with simply primary care and disease screenings. And we would have diabetes campaigns, and then do, diabetes testing and diabetes education, anemia campaigns, hemoglobin testing, anemia education. We do a lot of door-to-door campaigns. We did water, we did sanitation. Everything was a bit more campaign based, and that had its struggles because you're really depending on people to show up voluntarily for something. You have to convince them, you change the chip in their mind that they should learn about diabetes and test themselves for diabetes. So that itself is a challenge. So right before the pandemic, we worked with dental students from Switzerland, because my business partner Rosa now lives in Switzerland. And she said, I have dental students who want to come volunteer. And we said, great. So we got a dental chair, a dentist. We had big dental campaigns. And then when the Swiss left, we said, all right, well, we have this dental chair now. Let's continue offering dental services. And people started coming. And then a part of the anemia program, we realized that there's a lot of lack of nutrition health. And so we said, let's design a program to focus on women for their nutrition and maternal health. And guess what? That starts in womb. And there was a foundation from New York that offered to purchase an ultrasound for us. So they purchased it originally for a woman's health project, that kind of and child's health project. So the way that we got the dental chair and the way that we got the ultrasound were kind of like these opportunities that we had. When we closed for pandemic, we opened back up, we had this equipment, and we realized people still need ultrasound services, still need dental services. So after the pandemic is when it took on a feel of a little bit more service based. Before pandemic, it was a little bit more program, project, campaign based. And after, it's been more like, okay, these are our services. And so we started saying, all right, we're offering these services, using local professionals, using local doctors, and people started coming and needing them. And so now it functions a little bit more as a clinic. We hired a receptionist. We work with nursing students, um, as like our nurses. And then I was in the States, and our receptionist was like, Katie, a lot of people are coming in complaining about their arms and their bodies. I have a friend who's a physical therapist. Could she come in and like do physical therapy? And I was like, yeah, absolutely. And that's how our physical therapy started. And so everything started because we noticed we had the resources and the community had the needs, so it was just linking it up.
right. And how do you do that? It sounds like networking a little bit, the campaigning initial phase that we started about that you go spread the word, and I wonder always when you have these global health initiatives that something that I talked about with Jeff Mapp, the CEO of Extra Mile Pediatrics, was not to try to cause harm, to the communities, that we don't get that kind of effect where here's what we're going to propose to you and you're going to have to deal with that, but take the needs of the communities in mind. And so saying all that, what I wonder is, how did you do that market research of knowing that these are the needs? Okay, we need this ultrasound, and now these people from, I think you said New York, are providing it to us. So we have these dental students that are interested with coming with this chair. We can provide healthcare for that. Is that part of the market research you did? And how do you reach out to the communities in a sense that don't make them feel like, oh, these are, because it happens, and I think we have to be honest about it, that there is this kind of, you know, outsider perspective that we're going to come and change. And so there's a little bit of mistrust between the communities, the local communities, and the people that want to make, what is good intentions.
So that's where a couple things come into play here. First off, my master's of public health, it teaches very basic things, right? Get the local community involved, get the women involved. Those are two higher local. Those are three
Mm.
main pillars that I had in front and center as I was building CESAPU, and I was there every day. I think physical presence is a very strong thing in building trust. I'm there when I say I'm going to be there. I'm continuing to be there. I'm not leaving. For the first 3 years that we built the clinic, I was here full time, 3 years, almost every day in the clinic, building relationships with the people. And
Mm.
and then, there's just, so you listen to them. You listen to what they want. You listen to what they need, and then you respond. So all of our community programs were designed in response to what the community was asking me. Katie, we wanna have our own program, said the little girls. So I created a program and I used the knowledge I learned about, okay, we need to teach them about sexual and reproductive health. And then the little boys, Katie, we want our own program. And I said, okay, well, create your own program, and using my knowledge, which was, let's talk about social emotional development. And it's not rocket science. It's not rocket science to understand that if they don't brush their teeth, they're going to get cavities and they're going to have pain and they're going to lessen their quality of life. So
Mm.
in regards to the dental and the ultrasound, these are just basic services that every human needs, and I'm not forcing it upon anyone. The community is there and it's an opportunity for people. And if they want to take that opportunity, they can. And if they don't want to, they don't have to. And so it's been really interesting throughout the years to see who in the community has taken the opportunity. And I think
Mm.
there's another thing, and it's implementation science. So, yeah, nobody can argue that dental care is bad, or maybe you can, but if you really want to argue that. But the question is, how do you implement it, and what does that implementation science look like? So, and with me, that's okay, let's hire local professionals. Let's hire people who already speak the language. Let's, make it affordable. Let's, you
Mm.
know, so the way that you actually implement a program matters. And that's when it takes local knowledge and feet on the ground and trust from the community. Our
Right.
clinic doors have always been open. I've very, very rarely told people they cannot enter. Even if a program is coming and a woman enters, she can still sit and watch. The doors were practically never closed. It was not my clinic, it was their clinic. And I made that very clear. And it's still their clinic. The community has the keys. They come in, they know what to do, they have their responsibilities. They've really adopted this center as part of their community. And for me, that's like the best thing, because, who am I to just build a clinic and be like, this is mine? you know? So see, that constant sort of invitation, I think, um has been our strongest
Mm.
source of, success. And then now we're starting to get people passing the voice. Oh, I went here
Mm.
and they did a dental curation for only 20 soles, when in private it's 150 soles, or if in government you're waiting 4 months for an appointment. So
Right. It's also
word of
about
mouth has
streamlining.
been our number one source of growth, which is a great way to grow.
Yeah, I imagine for sure. And it sounds like you have to be very creative. This is kind of there's an entrepreneurial component to this. And, you said dental care, who's going to say no to dental care? And maybe in that case, I might imagine that most people of the world would say yes, but we don't have access to it in our community. Like it's a question of resources more than maybe cultural attitudes, let's say. But if I, may take another example from one of your program in the nutrition consultation that you have, there is, if I'm not mistaken, I'll show it in the video edit, that there's the supporting, and here it comes blending the local knowledge of the community with, practice modern standards of what a general healthy diet looks like. But there is the part of combining traditional indigenous diet with the eating healthy. And maybe we could take that example if you don't mind, and mention, is there a how have you implemented that? What is it that you, in a, let's say I come there and I want a, nutrition consultation, I want to prevent anemia, maybe, so what would you, how have you looked into the diet of the Peruvian people or the local communities and said, okay, we're gonna pick those foods to improve health, and try to not encourage people to eat these things.
Yes. So Peru is known for their gastronomical advances. They are like the number one gastronomy location in the world. Huge food destination. Peruvians take a lot of pride in their food. So there's like, I think something like over 400 typical dishes. And these dishes are typical for a reason. It's always the pollo al horno, the chicken with the mashed potatoes and the rice, or the everything like is a specific dish, which comes with its potato, and it's basically a lot of times 2 carbs and 1 piece of meat. And that's like the traditional dish. So what we do is we say, okay, here's the traditional dish. Let's sub one of these things for a more healthy option. So, for example, arroz chaufa is a very popular dish. It's basically like Chinese, it's a fusion of Chinese and Peruvian fried rice. So, let's do arroz chaufa, but instead of using rice, let's use quinoa, which is high in protein. So, we say, okay, arroz chaufa de quinoa. So we like take 1 or 2 ingredients of the dish and kind of flip it and say, okay, we're going to make this dish, but we're going to, instead of the potatoes on the side, we're just going to add a salad. Or instead of rice, we're going to use quinoa. Or because quinoa is very, very popular in Peru and quite affordable. And there's not a lot of dishes with quinoa in it. So we'll do a lot of quinoa substitutes. A lot of times they'll substitute the typical potato out with maybe like a sweet potato, or there's a lot of like lomo saltado is very common, or pollo saltado, which is essentially like a stir fry with steak, or stir fry with chicken. A lot of times will suggest that they use um, uh, sangrecita or buso, which is like really rich in iron to attack hemoglobin. Or to improve hemoglobin. So it's just about like changing 1 or 2 ingredients on a dish. That way, for the population, they're not having to deconstruct their whole diet and reconstruct a whole new diet. So it's like, how do we make like small, easy changes so that it's more sustainable, the way that this person can make those nutritional improvements in their lives. And then also just
That's so smart.
telling
Yeah, sorry, go ahead.
people, yo, you don't need to add 5 spoonfuls of sugar to your tea. 1 spoonful is enough. And like these are the downfalls of sugar, because there is a lot of diabetes in Peru, and a lot of metabolic syndrome. And so we also have to say, hey, this is actually happening, and what we're like, cut it back. Like, you don't need
Mm.
excess sugar. And then teaching them,
No.
what amount of sugar is in different fruits, encouraging them to, eat more fruit, encouraging them to eat more vegetables, because it is a very meat and carb diet. It's a very carb-based diet. So we try to teach, about carbs. Okay, they give you energy, but they need to be substituted with a vegetable and with an iron. And so we just teach them about, basic food
Mm.
nutrients. And
Mm.
yeah,
And
and we cook
a
every Monday.
smart move.
Every Monday we have a cooking a program, a nutrition program, and one Monday we cook, one Monday we learn about theory. So it's like cooking theory, cooking theory, cooking theory. And you can imagine the Mondays of cooking, there's always more people there because they get free meals.
Not so much people attending the theory
I
part, but
know. I'm
maybe
like,
you
how do we get more
implement.
people in the theory?
But maybe, implementing it during the cooking itself, practice and
They do,
theory
they
at
do,
the
yeah.
same time. I imagine that they do for sure. And smart, I must compliment you for the smart move of the quinoa, because it's also very low on glycemic index and glycemic load. So it doesn't raise your blood sugar as well. It's what that means in fancy medical terminology. And, very, I really like that very thorough, very clear explanation. And also using quinoa again, part of the local food. You don't resubstitute it with something else. And it's not like we in the Western world, in Europe at least, the traditional breakfast here, la colazione italiana, is the la pasta, which is not the pasta like pasta which most people associate with. But pasta can also mean pastry, something sweet, and then a coffee, usually an espresso or cappuccino in the morning. And the sweetness, the sugar that they add. It's not like we in the Western world
Right.
are not you putting too much sugar in our diet.
Same with
And it's
America. I
related to
mean,
obesity.
there's a lot to do nutritionally in the United States too. So, Peru's not
There you go.
isolated in their nutrition.
Absolutely. Absolutely. I just think it's so brilliant to combine you look at foods of the local community and say, hey, let's substitute that for that and still make it Peruvian, because as you said, they are very proud of their gastronomic, their kitchen, so maybe not, don't want to tinker with that too much.
Yeah.
Just a quick break and we'll head right back into the episode. And now, still going around in the domain landscape of the clinic, CESAPU, there is one thing I wanted to ask about. As you are in this kind of entrepreneurial endeavor, and we talked about, or you touched upon it, like how to you talked about the private dental care, which was a lot higher. I can't remember the exact number, but then you have the public one, but you have to wait for 4 months, I think you said. And then you have your clinic, which provides like a really decent price. Uh, can't remember exactly how much was it solas,
Soles.
the currency that you have there. Soles,
Mm-hmm.
scusa me, sorry.
Mm-hmm.
Soles. How do you keep the costs down in this case, not just for dental care, but I imagine also, you have to be, again, smart, I imagine, of how to keep the costs down. But could we take an example of how you might have been creative with keeping costs down, but still provide high quality care in terms of the CESAPU?
That is a very simple answer. It's called
Oh,
USD donations.
ah,
We get
right.
donations for our project from the United States. And so the dental program in specific is sponsored by a Rotary Club from North Carolina. A Rotary Club, I'm not sure if you know what it is, but it's essentially a group of professionals in the United States who want to do good, and they make these Rotary Clubs. They're all over the world. So they sponsor our dental clinic. and the university in Switzerland sponsors the dental clinic. So the donations that we get from foundations and donors in the United States supports the program. And the payment that the patient makes ideally goes to support because we pay our health professionals as well. Ideally, it goes to pay the shift of the medical professional of like that day. And if it doesn't get there, the NGO just puts in the rest, and we put in all the equipment and all the materials. So that's why we have donations from the United States.
Is it hard in general to do this kind of network donating? It sounds like, did you call it, forgive me for asking that, but the Rotary Club,
Mhm.
did you call it? Sounds like a philanthropy or
Yeah, it's
something,
a
like a philanthropy effort.
philanthropic organization, and they're one of our donors. We also we get donors by individuals. There's some family foundations that support us, and all of that information is published on our website in like our tax forms, our 990 forms. But is it hard? Mm, Thankfully, Americans are generous. There is a lot of money in the world, and I need to just figure out how to unlock it because we have a very affordable program. We can do a lot with a little bit. The dollar goes a long way. The exchange rate at this moment is like 3.68. And so, I couldn't build a clinic in the United States and fund it, but I can do it here in Peru. And so it's just a matter of showing the impact that their dollar has. We have a group of donors who are pretty consistent every year. I do fundraising. I used to host big fundraisers, and then I realized hosting a big fundraiser and simply sending out my emails, like, got the same amount. So, you know, but I used to host big fundraising events, tell people about the project. And, someone might write a check for $1,000. Somebody might say, hey, I have a family foundation. I can give you $5,000. Somebody might even say, hey, I can give you 15,000 or 20,000. So those donations are why we're able to have everything that we have.
Mm.
Yeah.
Yes. Just to make sure that I mentioned that there is on the website, I'll put it in the show notes, for course, for people that are interested to click on the
Hmm.
donating button and contribute to the
Thank you.
work of Hands On Peru for sure. I'll make sure also to mention that in the show notes and the websites and, social handles, the website and the social handle, of course. Maybe as I am talking about this, it will be the kind of, banderole under me that will mention something like that
Great.
for sure. And, so that is one way to make it. It's an ecosystem from what I understand. The few interviews that I've done, it's like an ecosystem that
Yes.
you have to keep alive, and donations seems to be an important part of it,
Hmm.
Uh,
We
how do you
generate
make
our
it
own revenue as well. We don't function on 100% donations. I would say about anywhere from 50 to 70% of our or 50 to 60% of our revenue is donations, and then the rest we generate ourselves, whether it's through our volunteer program, our initiative with Chimuk and the hats, or these services charging minimally for the services in our clinic. So it is important that we have a variety of income channels to support the project. Yeah.
Yeah, yeah, as part of the ecosystem, exactly. And maybe I was going to ask about how you make it holistic, but maybe you were starting that journey. The story of how to make it holistic too is to have some kind of also create some revenues from some self-implemented work. So from the services that you take from the fees that you take from the services and the brand of Chimuku that you sell to. There's this beautiful, for those of you, I really encourage you to go to their website or YouTube and watch this clip where I think it is you, Kid, if I'm not mistaken, that is during this video handing out payments to these women that have sold through this brand Chimuku. And there's this beautiful story of a woman, a mother, I think, that were able to build a bathroom, like a proper bathroom, if I'm not mistaken, in the video for her children. And so I just want to mention that I'm sure the donations and also the the women, yeah, the Chimuko brand, a community service that you provide, also generates revenue and also helps to improve life quality of the people of the community, right? Yeah. And so, could we talk maybe a little bit more about the holistic part and maybe touch on so we've talked a little bit about the clinic itself,
Right.
and then there's the community programs. You touched upon that you cook every Monday and that there's a bit of theory implemented with that. And then you have the Chimuko brand. Sorry for butchering that. I'm sure I am butchering that, but can we talk maybe a little bit about maybe non-medical aspect, but I think it's medical aspect too, because it is about the
Right.
patient as a whole, something that we really lack in Europe. I'm yapping on about this to everyone. Maybe, my friends and colleagues get tired of hearing this, but the kind of we have in Europe, I've mentioned it many times, that we just treat signs and symptoms. Here's a pill, take it. Okay, I have the
Mhm.
next patient to run to. And so here you have also the medical aspect. They come to seek treatment, but you also have community programs. So could we talk a little bit about the beautiful community? Maybe not everything, but the things that you might find important to share.
Yeah. Well, so first off, health is a complete state of well being, physical, mental, communal. It's not
Agree.
merely the absence of disease. So we come at it with that approach of holistic health, isn't just absence of disease. And same in Peru. It's, oh, I'm only going to the doctor when I'm sick and suffering and can't take it anymore. That's when I'm going to go to the doctor. So, how do we, one, get people to the doctor sooner or get them healthcare sooner, or two, prevent? And then on the holistic side, this whole aspect of mental health and communal health and feeling good, and how can we make that accessible for low income patients? And how can we do it in a way that builds autonomy, builds joy, builds friendship, and really walks with people in their journey towards good health? So not just, yeah, here's a pill, good luck, but okay, maybe here's a pill, but also, if it's going to be sustainable, you should come to our nutrition class. And so one of the first things I did was get the women together. I said, we need to have a women's club. Because if you remember, my business partner, Rosa, she's the nurse. I'm the public health, community health. So it's a fusion of the two. So I said, okay, let's get the women involved. We're going to have a mental health session. So I got the women involved, and we kind of did a little bit here, a little bit there. Sometimes two would come, sometimes four would come, sometimes seven would come. And then we started dancing, and they loved that. So we pulled dancing away, made it its own program. We danced in the clinic for like 2.5 years, but I still had the seed of a program. And I said, what do you guys want? Because they weren't really coming. And I was like, what do you want? And they said, we want to do things with our hands. We want to knit. So I went back to the States, had our second fundraiser, came back with some money. And I said, okay, I got money. I'm going to go buy wool. I started buying wool, and together we learned to knit via YouTube. And one of the best ways I can determine if a program is successful or not is how many people show up. And women started just coming in and they started staying. And so I said, this is it. So we learned to knit via YouTube. More and more women came. We learned together as a group. And it was my partner Rosa's idea that she was like, we should put a name to it and make a brand. And I was like, okay. So we put the name Chimuk Cheek and Chimu to honor the Chimu civilization, because we're located right next to the ancient Chimu civilization and the ruins of Chan Chan, which is a whole nother podcast episode. But and so then we had volunteers visiting us, and they would buy the hats. So it was a very organic growth the way Chimuk happened. I did not come in and say, I'm going to build a brand. It was much more organic than that, much more grassroots. And fast forward about 7, 8 years, we employ 20 women. Um, we've had a variety of business models, but the one we have now is we pay the woman per month per product. So the woman knows exactly how much money she's going to earn depending on the products she's making. So they prefer that because they can plan better their monthly finances. And then for us, it just gives us more fuel under the butt to sell them. So now we have this brand. We're selling in stores in Lima. We sell in Switzerland. We sell in United States. There's a lot we still have to figure out with this brand, but it's so beautiful because the women have a complete different reality now than what they did 10 years ago. Not only do they have an income, but they have a new skill. They have new friends. They have the actual physical act of knitting is extremely relaxing and good for their mental health. Their children get childcare because for free when they come. And then with that money, they're able to invest in their family's well-being and in their children's well-being. And so this brand, and they're ridiculously talented. Here's one of my hats. We made bucket
Yes,
hats
please.
recently.
Let's see.
So this
That
is my
is
little
amazing. Look at
bucket
the
hat.
color.
And we
Amazing.
made the decision to use source all of our wool from Peru. This is 100% cotton. And then we use 100% baby alpaca from the highlands of Arequipa. So we use natural fibers, and the fibers themselves, no alpacas are harmed in the making of the alpaca wool. Um, if anything, alpaca is a very sustainable wool because one, the wool itself is very weatherproof, very moisture proof, very warm, and it's almost self-cleaning. And then the alpacas, they graze at such a high uh, altitude and they have soft hooves, so they don't degrade the mountain so much. And it supports the alpaca farmers as well. So yeah, this is our brand. And the idea, as I mentioned earlier, is, health is holistic. Like you can't tell a woman you can't expect that one doctor's visit is going to change somebody's life. You've got to be there in the trenches with them. So this program
Mhm.
has really allowed us to get to know the women and and watching them and the way that their lives have changed has been an honor. I love
Feels
this.
good in the
I
heart,
love
I
this
imagine.
program.
Yeah, sounds like it, and such a good effort. I think I especially love the part where you mentioned that it is kind of relief for the mental health. Especially if you come from impoverished communities, there is enough stress already. And I can mention
Yes.
from my
And there's
own growing up
loneliness.
in Morocco. Yes, for sure. Mention from when I grew up myself we visited Morocco every once in a while, every 2 summers when I was a kid and in my adolescence. And you see real poverty there, not European poverty, as I like to call it, but real poverty where people really don't know where their next meal is going to come from. And it creates a lot of mental stress and strain, and I just, now, I will admit that I don't know what the situation specifically looks like in Peru, but I imagine that if it is a center of creating like a mental, yeah, like you said, like a holistic care, you create a hub for relaxation to just be free during the knitting. And it was so relaxing and you listen to the community. I really love that you ask them, what do you want? Because people are not coming to what we wanted initially in the UK. We want to work with our hands and knit. So congratulations really to that. It sounds like really hard work, effort and perseverance. And again, beautiful hat. I'll make sure to share that in the show notes for people that will want to buy the product from these amazing women, Chimuk, from the Chimuk,
Yeah, these are our summer bucket hats. I saw
for
Jay-Z
sure.
wearing a crochet bucket hat years ago, and I came to Chimuk. I said, "We need to make bucket hats. Jay-Z is wearing one." And I'm so glad we did because they're like our best sellers now. But I do want to
There
note,
you go.
on the mental health side, um, we have Chimuk meets every Tuesday and Friday, and every Friday from 4 to 5 we meet as a group and do some sort of dynamic activity. Maybe we have a guest who comes in and talks about a certain topic. Maybe we have a different type of activity or a sharing or a game, or, talking about how to deal with your children who are adolescents. So we do have like a mental health window every Friday afternoon for the woman. And that's like a mandatory part of being part of the brand. So it's not just come in, knit, get your wool to knit and leave. They have to be a part of that program. And that's
Mm,
um and it's been mandatory. If they don't come to that, they don't get wool to knit. And so that's
right.
been really important for us as well.
I imagine. And, maybe touching on the next aspect of it is the finishing aspect, or the final part I want to touch on is the volunteer service. We talked about how people can contribute. Okay, so they can buy the Chimuk products, they can donate for sure. And then there's this whole volunteer program, which might be of extra interest for my friends and colleagues that are listening, and including me, who's a medical student, because you talked about actually in the beginning of shadowing doctors, and there was, too much demand of volunteers in relation to the doctors that you could provide for shadowing. But could we talk about a little bit about the volunteer work you provide? I saw it on the website. Again, I'll edit around it during our video conversation on, show something nice there. But you pay a certain amount of fee, and then you are provided with, if I'm not mistaken, please correct me if I'm wrong, but with lodging, with housing, with food, and then also the possibility of doing some kind of clinical practice, and perhaps maybe if you're not of medical background, also something related to the community programs. So could we please, I am super curious about this, to the point I'm going to admit after the interview, I hope I can have just a small bit of a conversation, because we are a few students here at the University of Bari who's interested in humanitarian medicine, and maybe come there next year we're planning to Latin America. But this is a whole other conversation. Maybe focus on the important part about the volunteer program that you offer.
Yeah. So one of our pillars is to train the next generation of global health professionals. I never would have done this work if I didn't have the opportunities that took me to Honduras and Africa and Peru. So I believe in the power of volunteering because it's how I started, and it's how Hands On Peru started. And the idea is you come in and you learn. You learn about the Peruvian healthcare system. You learn about our initiatives and the success that we've had. And hopefully you take that back with you into your own career to, start your own project, or, keep pursuing global equity in access to healthcare. And
Mm,
so
mm,
we take a variety of volunteers, and they can be medical students, they could be dental, nursing, physical therapy. We take a very wide variety of medical volunteers, and then we'll customize a trip for you. So let's say we have 6 dental volunteers. We say, all right, we're going to have 2 weeks of dental campaigns. And during those dental campaigns, everything is free. We don't charge the patients during those campaigns. Or same thing with PT. If we have 6 PT students, we'll say, okay, we're going to do 2 weeks of PT campaigns, and everything's going to be free. Um, or if you come in just 1 or 2, you can come in, support the doctor, watch them, learn from them, help us in triage, help us with glucose testing, anemia testing, um, uh, cholesterol testing. And then you can go into healthcare centers that's not our own. You can go into the local hospital or another local healthcare center and see how Peruvian system is run, and then see how our system is run, and kind of be able to compare the two. And so we work with a Dr. Diana at a local center for health. And she used to be our chief of nursing before the pandemic, and now she's a doctor. And so she loves taking volunteers and showing them her health clinic, and volunteers love going there. And our nurse, Cindy, who works with us currently, she works at a government hospital called Jerusalem. So she'll take students into the hospital and place them in with different doctors. They can observe surgery, um, and they get to see like a bigger hospital. and we work with another 2 other healthcare centers nearby, because now we have better relationships with all the local healthcare centers. We've built up our relationships with doctors, so it's not so much a problem anymore of finding where to put the students, maybe in the beginning, but not so much not so much anymore. And yeah, you just it's a learning process. So how can you learn from the Peruvian healthcare system and then give back? You know, give back in terms of giving education or giving free testing. Um,
Mm.
yeah, and things like that. And if you're already a healthcare professional and you want to come in and help practice, we can customize that for you as well. I do want to say we are, the basic care, PT, dental, doctor, ultrasound. So when I have these fancy neurosurgeons coming to me saying, I'm a fancy neurosurgeon, I'm like, I don't know what to do with you. so, um, but if you are like a dental
That's,
professional and you want to come and practice, we give you that opportunity as well. And then yeah, you get lodging and food, which is nice because we usually put you with like a host family, and then you get to try all the delicious Peruvian food that we talked about. We'll take you on cultural
yeah.
activities, things like that. And then the Masters of Public Health students come down, and I'm their supervisor, and I teach them about participatory programs, interactive programs, how to you know, evaluate programs. Um, and then I'm their direct supervisor for a lot of like MPH students, or we get some psychology students once in a while, maybe a couple social work students. And that's where I come into play. But the medical students, they're the ones who work a little bit more with Cindy and Deanna because they're the medical professionals.
Right. Really encourage people to check this out, especially those of you that are listening here in Bari, to check out the programs. You also list the dates of, if I'm not mistaken, when the next medical trips are about to occur, if I'm not mistaken. And please check that out. I think it's in terms of the neurosurgeons or the fancy machinery, high advanced medical professionals, I think this is very good to get to see medicine practiced in a kind of low resource setting, but with high efficiency. You have to be creative, and there are some really good initiatives. You have to think on your feet a little bit and be creative with how to implement. You said the ultrasound scan. I would say that is a lot better from a efficient standpoint of view compared to bringing in, let's say, a PET CT scan or an MRI, because you can cover a lot of distance with just an ultrasound scan. And it's just you have a it really, this maybe relates to Doctors Without Borders and things like that, but in kind of maybe more strained, let's call medical clinical settings, you have to be creative in the
Mhm.
sense. And so,
And in
thank you
Peru
for sharing.
in Peru,
Yes,
the people who work the ultrasound machines are doctors. There's not ultrasound techs who then need to pass it to a doctor. So the doctor is trained in ultrasound, so they're able to do the ultrasound and give the consult in the same session, which is effective when you're talking about low resource settings.
there you go.
Um,
There you
it's
go. Very
efficient for us.
concrete example, I
Mhm.
think. Yeah, that's a very concrete, good example. I didn't know that. So that's really good. That's really good. Again, taking the holistic care, but also like effective care. And I think, we're reaching the end of the interview here. And I would just like to mention again, encourage people to really check Hands on Peru, the CESAPU, the Chimuk brand, and I'll make sure to mention everything in the show notes and really to check you guys out. I think really, Katie, that this is an amazing initiative. And, it really warms my heart to see people like you around the world that are really, this is what I want to do with medicine when I graduate, I want to dedicate. Yeah. Yeah. A big victory, for global health initiatives. But it's good to see it's really good to see maybe now in the world where there seems to be a lot of apathy and just, territorial struggles, and which is affecting always the victims are always the impoverished people in the end that get affected the most. So it's good to see people that are as you seem like a very optimistic, compassionate person that are just hardworking too. The commitment, one of the things that really made me think of that was when you said, okay, I'm going to stay put in Peru for 3 years to make this work, and congratulations to the accomplishments that you guys have made, and best of luck from the bottom of my heart to your future endeavors.
Thank you so much. Much appreciated.
Thank you so much for listening to this episode. I hope it brought you a new perspective, a moment of reflection, or even just a little bit of joy. You can find the video version of this episode on my YouTube channel, links in the show notes. And if you enjoyed the episode and would like to see more, please consider giving it a like or leaving a review on Spotify, Apple Podcast, or on my YouTube channel. Your support really helps others discover my content, and so, again, thank you for listening and for being part of this. I'll see you in the next episode of Medicine and Healthcare Around the World.